Welcome to the National Rural Health Executive Webinar Series. My name is Colleen Bay with NRHA Services. I have just a few housekeeping notes to review before we start. All attendees are muted. We're going to try to get through the webinar in about 45 minutes, offering some time for Q&A at the end. If you have a question for the presenter at any time, don't hesitate to go ahead and type it into your GoToWebinar control panel, and I'll make sure that it gets covered at the very end. And as a reminder, this event is being recorded. You will receive an email today with a link to the recording. Today, our presenter is Mike Milligan, President of Legato Healthcare Marketing. As a healthcare marketing strategist and industry leader, Mike leads his team and clients on a broad range of internal and external marketing and communications activities, including brand positioning and identity, public relations, crisis management and reputation management, marketing strategy, advertising, digital and social, employee communications and engagement, referral development, provider communications, and community outreach. Mike has directed strategic marketing planning efforts for a variety of rural healthcare organizations, serving as counsel for CEOs and other executive team members. He is a highly requested speaker for healthcare national conferences and is a regular contributor to the industry publications and blogs. Due to his involvement in the industry, Legato is the exclusive marketing partner of the National Rural Health Association. I'd also like to take this opportunity to say thank you to Legato. They've been a dedicated partner since 2013. We appreciate the support and the industry expertise that they bring to our rural hospitals and clinics. NRHA partners like Legato play a significant role in supporting NRHA's efforts on Capitol Hill, as well as allowing us to put on educational conferences dedicated to issues and topics in rural healthcare. With that, I'm now going to turn it over to Mike for our feature presentation, Targeting Your Rural Health Message for Maximum Results. Mike?
Great. Thank you so much, Colleen, and thank you everyone for joining us. We have a really nice sized crowd today, which is really a pleasure to see. So obviously of interest to a lot of people. So just to kind of get us going here, as we're talking about here, the message overall is about targeting your rural healthcare message. Now we're going to talk about when we reference targeting, coming from a couple different perspectives. One perspective is doing the proper planning that we need to, using market data to help drive that strategy. Then overall, how are we forming our goals and kind of getting to the different aspects of that. And then in terms of targeting your message, part of how we're doing that, of course, is by making sure that we have a strategic marketing approach, but then there are also other ways that we target in terms of either specific digital marketing or being cognizant of how different generations might react to different messaging. We have a lot of things to cover, in a webinar. I'm going to cover things, in a pretty broad perspective. And obviously, if there's ever questions afterwards, either today or another time, we can certainly get into a lot more detail. And again, how to prioritize services. And of course, what we're always looking for is measuring the effectiveness of your marketing efforts. So with that, I'd like to just take a quick poll question, have you do a little work here before I do the more talking. If you could just answer the question here, and I think Colleen, you're gonna, I think, bring this up on the screen. There we go.
Yep, it's up.
Okay, great. So the question is, how confident are you in developing goals, objectives, and priorities for your organization as part of your annual marketing plan? Not necessarily even your strategic plan right now, but a part of your marketing plan. How confident are you in developing goals, objectives, and priorities? Take just a second to answer that. That would be helpful.
Right, and for those that are dialing in, we do have 5 options: extremely comfortable, very comfortable, comfortable, somewhat comfortable, not comfortable at all. So I'm going to leave this up for about 5 more seconds. Okay, let's see where we're at. Okay, so we have, oh gosh.
All over the board?
Yeah, it is all over the board, and this is totally hiding. Okay, so 2% are extremely comfortable, 30% very comfortable, 28% are comfortable, 37% are somewhat comfortable, and 4% are not comfortable.
Okay, sounds good. We have a lot of modest people, which is good too. So, so anyway, hope that's just helpful background to know. Thank you, Colleen. Kind of just gives me a perspective, and hopefully toward the end will even help you feeling a little bit more comfortable. So, all right. So first of all, as we talked about, first step is developing a marketing plan. It seems like a basic thing, but it really is one of those areas that think is often overlooked, and sometimes how one might define a marketing plan is not necessarily just a list of the things that we're going to do, but it's based on strategy, and ideally it's focused on aligning with your strategic plan, looking at, and it's, certainly depending on how you do your plan, the different pillars that you might have and things like that. And they're not always, I mean, a lot of it's focused on the growth pillar, but it might be focused on other areas in terms of improving quality, lots of different things. But ultimately, when you develop that goal, that should be your framework. So where do you start? Okay, so again, we're going to talk in a second here, but it's really about identifying some measurable goals, from their strategies and tactics that support those objectives. Then determining how you're going to really decide, okay, there's lots of things to do, but how are we going to know what to do first and what emphasis we're going to put on things? Because it's very common, and particularly, in rural health, certainly we don't have an abundance of budgets. We have to be very strategic. Sometimes we have to outthink our larger city competitors as well. But we have to decide what we're going to focus on, what we're not going to focus on, and how much emphasis we're going to place in those areas. So this is just as background. The key here is there's a process that we use, but more importantly is, do you have a process that you work with? And I provide this just as an example in terms of just either an affirmation or reminder of how we need to think about our marketing. And ultimately, again, this is about, the premise of this presentation is targeting your rural health message. And that's part of being able to do that, is having a objective driven marketing plan. So, so the first couple parts here, I'm not going to go through in all detail here, but just that we have to do a lot of information gathering. I'm going to talk in a second about how to do that. Sometimes when we're working with organizations, in addition to the data, it's doing a lot of, internal types of interviews with key stakeholders, all those types of things. But we're going to talk about a market analysis a little bit, and a competitive analysis. It's taking that data, really absorbing that, but then, do we have research? And we're going to talk about that in a second. Do we need to develop our brand? So the point in all of this is that there's a lot of upfront work that we do before we get to the point where we would call the marketing plan, or what we call the treatment plan, which is getting into the specifics of what are we trying to accomplish, how are we going to do it, what tactics are we going to use to do it, and how do we execute it. So again, I just want to emphasize that it really is a process. Sometimes we think, well, how do we decide on our marketing? Well, it's whoever is the loudest or the squeakiest, and I would just argue that that is not the best approach. So to give you, to kind of break down some of those areas a little bit more specifically. So first, I would say that we have kind of as a step one, and I kind of mentioned before about, some of the upfront work that we need to do, and it's taking a look at the past, taking a hard look at the past. So we mentioned that strategic plan. Sometimes, yes, it's looking at the current plan, but even reflecting on the previous year's one. How have things changed? What are the priorities? And oftentimes, there are areas in a strategic plan where traditionally one might think, well, how does marketing have an impact on that? And one might be surprised that, yes, a lot of our marketing is certainly focused on areas of growth, in particular where we're trying to grow, outpatient procedures, surgeries, diagnostics, those types of things is really where a lot of marketing should be focused on. But oftentimes there are other goals within a marketing plan, such as, increasing patient satisfaction or internal communications, those types of things where marketing and communications can have a strong role as well. Understanding data, so again, we're going to, a lot of times we are tempted to kind of shoot from the hip, but as much as possible that we can use data, and we're going to talk about that in a minute, makes your marketing more likely to be successful. Evaluate and respect community perception, whether or not that's through actual data, or perceptions and awareness of things that you know of in the community. And again, when we look at goals and data, that allows us to establish baselines in order to form our goals and of course focus on the future. So let's start with market analysis. Again, this is all about, in order to get to that destination of getting to those beautiful ads or whatever it is we're going to create, we have to think before we do. And so we have to first gain an understanding of where we currently are. And there are lots of ways to do that. Depending on your organization, what access to tools you might have, there's certainly a lot of state data. Sometimes there's other third-party data. We have a partnership with Eide Bailly, and we often work with them on some of the. There's lots of ways to gather the information, but the fact is that maybe we have access to some information, some we don't. But a lot of things that we're going to talk about here, you actually even have within your own organization. So speaking of that, so when we look at that analysis, certainly looking right now at our existing patient base, where are people coming from, what's the payer mix, what are the various reimbursements in terms of kind of determining where we're going to focus things on. Certainly going back and looking at what the needs and trends are in our area. We either will know that through research that we've done, or we're going to be looking at our community health needs assessment as well. And we're also going to be looking at projective demographic changes. Is it growing? Is it shrinking? Is it aging? And again, that's going to be really key, not only in how we're assessing what we're going to be doing for marketing, but it can impact a lot of things in terms of physician recruitment and those types of things as well. Obviously, we're always looking at volumes. Want to be aware of what's happening competitively, which can oftentimes be even really continuing to do, maybe for a few years, really doing like a competitive analysis where we're going and examining what services are available currently from our competitors, how we stand apart, those types of things. That really helps us to kind of look at gaps and identify needs in our marketplace. So part of that market analysis, of course, is defining our primary service area. And even though we may have done that, I think sometimes we need to go back and re-examine that, just based on a lot of the factors that maybe have changed over the years. So some of the basics, of course, is we're looking at population, age, income, other demographic information. As I mentioned, we have, and I'm sure you have access to a number of tools that you use as well, but as an example, and using the advisory board, they have a number of tools that we often use in conjunction with doing our marketing planning. You're looking at inpatient, obviously, and outpatient volumes. A lot of marketing, generally speaking, is certainly focused more on outpatient volumes. That's the majority of where we're going to be focusing, is how do we get the surgery suite busy? How do we get the diagnostic areas busy? Certainly there are areas that are focused on, building the overall perception, but in terms of having marketing really impact and target prospective patients, it's focusing on those outpatient areas. Competitive presence, again, we want to look at what's happening there, looking at quality data, again, market share data, all of those things to just soak in as much information as we possibly can. So then from there, as we kind of do that analysis, then we need to make sure, and people within your organization that can certainly help do this, and it's just a matter of really getting the discipline of making sure we're doing this on a fairly regular basis, of looking at our market share within particular areas and specialties, and looking at that overall capacity as well. So as an example, just these are just illustrative examples a little bit to just give an idea of the types of things that we should be looking at. So you can see here, this particular one is an organization, and we're looking at various service lines, and we're looking at based on a number of different factors in terms of the population and the growth and all those sort of things. But you can see here, as an example here, if you look at, for instance, orthopedics. Well, in this particular market, actually this was a real world example of a customer, but 39% projected growth in 10 years. Well, that kind of tells us something. That tells us in terms of recruitment, tells us in terms of trying to capture the market before others do. it tells us a lot of things, and if anything, it provides even some additional support as we're having conversations internally with physicians and other leaders as well. And just, some other, again, just for illustrative purposes, but, showing particular procedures as well. One of the ways in which we look at how are we targeting our message in rural healthcare marketing is that we often look and say, if we're trying to market, let's say, for instance, if you have the luxury of having a specialty physician in your area that does procedures, let's say, that maybe you have the opportunity where you have a urologist that's on staff, as an example, or not even on staff, but I mean a visiting urologist who does certain outpatient procedures. Well, generally speaking, what we're doing is we're going to actually market specific procedures. We're by marketing a problem and a solution or a treatment to an issue. So as an example, we may be targeting a specific urological procedure, but we're going to market incontinence. We're going to have a message that's going to be focused on, that you don't have to live with a leaky bladder, and what does that mean to you, and that there are solutions to that, as an example, or whatever the case may be. But then as a result of that, we do have a long-term target that we're going to be looking at, how do we, what are our baselines for these specific procedures, and then seeing if there's a correlation between the increases in volume and how we targeted those specific procedures. So again, data is our friend, and as much as we can access that and help that to base decisions, all the better. So again, just some other examples. Again, we're always want to be looking at different volume projections. This is referring to swing bed as well, and some other outpatient procedures. So that is one way, of course, we get to that targeted is that whole market analysis part of things, looking at what our data is. Then there's the market research part of this, and I certainly understand, especially with us, working primarily in rural health, we don't always have the luxury of the budget to invest in market research. I do suggest, if we can, that it is helpful to try to invest in doing something like that, maybe every few years or so, just to give you some kind of a baseline. Otherwise, there are, as we'll talk about, some more qualitative information as well that guides us in some way. And it's certainly, part of your oftentimes your community health needs assessment. It does give you some background. Sometimes they're not necessarily scientifically valid studies, but they do give you a guidance. So anyway, from a consumer research perspective, again, really understanding, in addition to the analysis that I just mentioned to you, of different studies that we can do. Sometimes, generally speaking, we ideally would be a quantitative study where we're whatever methodology it is, from phones to internet to what have you, of really being able to, as we'll talk about in a second, understanding the awareness and preference of various service lines. But then we can also explore a lot of things in terms of consumer preferences, patient experiences, again, awareness, where people are going out of your market, and if they are, why are they going out of the market? Those are such helpful things to know in terms of not only who to target, but how to tailor the message. So I mentioned before, for instance, the quantitative part, that's really kind of, in my from my standpoint, that's the ideal way to go, because it's the most reliable. There are purposes for qualitative as well. Generally, when I would look at a qualitative study, it might be in the form of a focus group or things like that. They're really more to gain insight into a particular area. For instance, I've been involved in where, let's say, for instance, that we know as a strategy that we're going to focus more on women's health. We've already decided that. But maybe we know that potentially there are some barriers, or there's some reasons why, let's say we have OB, for instance, and we know that there are some reasons why or why not women might want to come to our facility, and they may have some concerns because maybe we don't have a NICU or whatever it might be. Well, it's an opportunity for us to learn more, to potentially test some messages, make sure they're believable, those types of things, and really learn. And I think there's a lot of value in that. And I know, we're, still in, in a COVID world, so doing some things in person um, isn't always as viable. It's still my preference, but obviously we can do a lot of things virtually now as well. Although when it comes to focus groups and things like that, there's a whole different dynamic that comes into play of kind of seeing the interaction in a group. I would say as well that, depending on what you provide at your organization, if you have, for instance, a patient family and advisory council, that there are ways that you can kind of utilize that group to kind of test some things and ask some questions and those types of things as well. So generally speaking, it's a great public relations strategy in many ways to engage your community in testing messages. So as an example, when I was kind of talking about the um, quantitative study part of things, um, generally what we're measuring is we're measuring a couple different things, but we're measuring awareness and we're measuring preference, or sometimes what we call likelihood to use. And not to get too deep, but the kind of the the key is to try to find that balance between awareness and preference. So as an example, you can see here, this is kind of an illustrative sort of point here, but we look at, okay, where did the awareness, what was the particular awareness in this one right now is in a secondary service area of these various service lines. And you can see how the difference may have changed from year to year, and you can kind of look at that and say why. But even more importantly to me is that you can start to look into that data a little bit deeper and look into, okay, how did that change by age, by demographic, by payer mix, and then even look at, okay, how did that change by primary service area versus secondary service area? That tells you a lot then in terms of, okay, how do you target that message, and that everything doesn't need to go to everyone, as an example. So um, and then so that's awareness. Now keep in mind, so when we call preference, that means even though you might be aware of something, how likely are you to use it? Okay. And this particular graph kind of shows that preference even among, maybe different hospitals or peer groups or what have you. And the key to remember in that is that someone can really be aware of something, but that doesn't mean they're going to go there. We always focus a lot on, well, I hear a lot about, well, we just need to make people aware that we have these services. I hear a lot in rural health. And I think that is true because there are consumers that, patients in rural communities that often, maybe don't give rural hospitals as enough credit in terms of what we all actually offer. But there are sometimes even they might be aware, but they don't go there because they have certain perceptions. So what that does is that says, okay, yes, in our marketing, in our messaging, we need to make people aware, but we have to get a little deeper in our messaging. We have to maybe overcome certain barriers. Maybe they're not going there because they are not certain of the quality, or there maybe is a convenience, or there's a customer service issue, or whatever it is. So that preference allows us to kind of hone in on that message a little bit. And then the idea behind all of this, again, is if you're doing these kinds of studies during different, periodic times, that you can look at trends and see how did that change. Ultimately, you can form some of your marketing goals, based on objectives around research. So anyway, so what we covered there is a lot of looking backward. Okay, that was either the market analysis or it was the research. Very important. Then based on that information, we get to a point where we can really form some measurable goals. You're familiar with goal setting, whether or not it's in strategic planning or whatever. I'm sure you're not new to the concept of SMART objective setting, and it falls into place as well for marketing: specific, measurable, achievable, relevant, time-based. And the point that I want to make here in terms of the takeaway is that when you're doing a marketing plan in your organization, whether or not you're a member of the marketing team, or you're on the executive team, or whatever it might be, that I spoke earlier, or just hinted a little bit regarding Prioritization. Well, deciding what we're going to do and what we're not going to do needs to be based on what our objectives are, what those measurable goals are, and what they're not. So one of the things that I often see is that, it's very common, of course, and I've worked in healthcare my entire career, and so I've I've been on the executive table and everything else. I know what it means when a influential provider comes to you and says, I want this, or I want this, or I want to be on this billboard, what have you. As an organization, we have to be in agreement on what our goals are, so that when we get those internal or external pressures, yes, we're going to look for ways to accommodate and appease people, but we also have to stay focused on what the key goals are. So that is so important, and particularly when maybe in your a marketing role, that you have to go through a process of really buying in and getting consensus on those objectives before you do anything else, before you do any advertising, anything else. Let's come to an agreement on what those goals are, and as specific as possible, of course. So when we look at goals, again, I generally, kind of two different types of goals in my mind. They relate to one another, but there are more business goals, so that are more focused on things like increasing volume, market share, profitability, all those important things. And then there are more what I would call marketing or communication goals, which are important as well, but they're going to measure things like, the community perception or awareness, or we're going to get into things like, website visits, digital marketing, all those types of things that are other types of measurement. So you want to look at, both types of goals. And when we're forming those goals, there's a lot of things to think about, a lot of things. And, again, to be as specific as possible certainly helps. But you can see here that the more specific that one is, the more likely that you are to target what you're doing. Let me kind of give you an example. So let's say, let me just see here actually. Well, before we get to that, so you kind of see some of the other areas here that we need to consider in terms of market share, volume, awareness, payer mix, age, gender, what kind of insurance. Maybe there are goals around patient engagement, patient satisfaction, downstream revenue. Again, that's a good example of, okay, you might hear initially, well, that doesn't make us any money. There's certainly arguments on both sides of the fence in terms of OB as an example, but you can argue about, the value of a patient long term and those types of things. So lots of different ways to form goals. This example is one that is, maybe more focused on, not the kind of more on the business side of things a little bit. We're talking more about volume. So, generally we'll see in a strategic plan where we'll talk about, okay, we want to increase outpatient surgeries. And I realize every rural hospital doesn't have the luxury of having an orthopedic surgeon. Some do, some don't. But just as an example, so, okay, well, increase outpatient volumes. That sounds great, but let's get more specific. So this particular example says increase outpatient orthopedic procedures by 4% by the end of the 2021 fiscal year compared to the previous year in the secondary service area with adults between the ages of 45 and 55. Okay, when you start to get more specific about that, if that really is your goal, that really helps to drive your messaging. So you look and say, okay, within my secondary service area, okay, there are a number of reasons why maybe we chose that objective, but that all of a sudden you start to think about, okay, messaging, you start to think about, how we're going to target people, is it going to be mass media, is it going to be digital, how are we going to do that? And you start to look at the age demographic and you say, okay, we're probably focused more on a commercial market. Maybe, generally, are we focused more on sports medicine than we are joint replacements? I mean, a lot of things that it starts to really help you focus your thought process and your target by getting, and that ultimately then should drive, what you're doing. And, to keep in mind that there are a lot of different strategies, and certainly, advertising could play one part of it, but there's a lot of things that we do internally in terms of the referrals that we have and those types of things that ultimately, as we get more specific on that objective, helps us to be even more narrowed on our strategies as well. Okay, so we have that objective setting that we talked about. Then it's making the plan. Okay, now it's finally we know where we want to go, we know what we want to achieve. Now, how are we going to do it? So we got to determine, okay, what service lines get more, and not them what's more important, but what receive more attention or more budget or more focus than others. And what we'll talk about here in a second is you can certainly, whatever style works for you, we have something we call the tiered approach that I'll talk about. I kind of already hit a little bit on this administrative buy-in. It's really critical. It's one of the major things that I see where marketing plans fail, is that you don't have buy-in within an organization and you're zigzagging all over the place. So, and again, just agreeing on those objectives and those priorities. So in terms of the prioritization, so as we look at, different service lines, and so this is just to give you an example, you may or may not have all of these different service lines that are in the left column here. But you look at this and say, well, I have a limited budget. Everybody wants everything. How am I going to decide what we're going to focus on? You can't just take everything and divide it by that many. It's not going to be effective. It just isn't going to work. So how do we do that? So what we suggest, and you have your own method, but just again, we look at a webinar like this and you take away some key things that maybe you can look at in your internal process and see, how can we improve them. But these are different criteria that you want to look at, and you might say, yep, they're all important, but you also might look and say, well, are there certain ones that we would rank in a certain area? So, does it improve goodwill? One of the biggies is it market ready, which seems so obvious, but something, sometimes we'll hear a lot about, well, let's market this, and then we learn that there's some kind of a customer service, there's an insurance issue, or there's even just a capacity issue. Then we're not ready to market that yet. And really, what is the profitability? It's if that's one of your criteria. Not everything I realize is driven by profitability, but it certainly needs to be one of the top things. And so, and if things don't fit into these certain criteria, it doesn't necessarily mean that we're not going to place emphasis on a service line, but it's just a matter of how much emphasis. So you can see here again, we look at other things like, is there differentiation? What's the competition look like? What kind of capacity? Is there actually a situation with a competitor where we could maybe capitalize on some kind of a weakness as well? So then the process that we look at here is, again, you can have your own, however you do this. To me, it's more of the thought process that's most important than exactly how you do it. But what we're suggesting here is we generally, when we look at the various service lines and we weigh them against all these various criteria, then we place into what are called tiers. And the general concept behind this is that if something is in a tier 1, that means that 60% of all of your resources are devoted to that tier, and then tier 2, 30, and tier 2, 10%. So what that means is that you may only have, for an example, let's say that you had 30 service lines. Well, it's very possible that you may only have at max 4 or 5 things in tier 1, because generally you want to look at a philosophy of doing doing things very well and being very focused on them. And so as an example, and there could be 20 things that are listed under tier 3, and you have to divide all those up between 10%. And when you do your marketing planning, if you kind of go through that discipline of doing that and having that kind of conversation, we realize that marketing plans are fluid, things change all the time, but at least to be able to make those priorities really helps you to focus and also use your limited budget as efficiently as possible. So, we've taken it as far as, and, it just depends how analytical you are, but, if you look at this particular chart, we look at the different criteria, and we've actually applied different weights to them. You could decide that as well to really help you, and then you come up with a score in terms of how you might tier that. what it does is it, again, walks you through that process to help you prioritize, but it also really helps you sometimes internally as well when when you're getting, various pressure of, and I don't mean to take anything away from, but, the home health group comes to you and says they want an advertising campaign. And you say, well, we're very happy with what you're providing here, and we're going to help you celebrate Home Health Month, but it doesn't qualify, for a larger campaign, but here's what we're going to be able to do for you. So you kind of see, then we sort of look at, and this is just a representative example of how it might fit. It all kind of depends on how you meet this criteria. So as an example, in this particular situation, you see urology is under tier 3. Well, generally speaking, that should definitely be tier 1 if you're looking at profitability, but it might be in tier 3 because we don't have the capacity at this point. We're very limited in what we're doing, but we're currently recruiting for a urologist. Once we would hire a urologist, then obviously that's going to move over, but it just helps us to keep that sort of focus. So that's the prioritization and the marketing planning part of it. And then from there, it's, managing and owning that plan. So again, part of this is we kind of talked about how are we assessing our goals and forming that consensus among in our organizations. It's continually communicating as well, holding meetings with key stakeholders. How are we doing against our goals? Being very transparent as well in terms of where are we doing well and where we aren't. If we're not doing well in a particular area, let's talk about it. Let's look at the data. Is it a matter of marketing? Is there something else? Is it a messaging thing? And let's use that data as a way to make management decisions. So I want to switch a little bit now. So that was kind of all background in terms of targeting by forming a, effective marketing plan, how to reach, key demographics, those types of things. And just, again, kind of taking another way of kind of demonstrating the way that we should target our rural health message is also being very cognizant that different generations respond to different messages, through different ways, through different medium, things like that. And so what we want to do really is we kind of want to look at different generations and really, in a way, kind of look at them as individuals, and sometimes where there's certain content that needs to be tailored. So I'm moving a little bit now from kind of more broad and planning to a little bit more, again, it's broader, but just to kind of remind you as you're forming your messaging and you're trying to target your rural health message, that there are different ways and different ways that people respond to messaging. So as an example, I'm sure we're all pretty familiar with the various generations, so I'm not going through that in particular, but what I want to talk about is just how they receive information. And this is, very broad, but for instance, we look at the first audience, and those are people, they're called traditionalists. They're born between 28 and 45. The takeaway here is that they want to be directed. They follow their physician directions explicitly, okay? They're taking healthcare advice from credible healthcare professionals. So you think about that in terms of how we share our message, they as compared to what you might think of other generations. I'm not implying that they don't think for themselves, they certainly do, but they just respect maybe authority a little bit more than maybe other demographics. So they're really fine with what does the doctor say kind of thing, okay? You go to the next category, baby boomers. Moving down that pendulum a little bit, they want to be engaged. They are actually searching for healthcare information online. They are influenced still by traditional advertising as compared to maybe some of the other demographics. They're starting to make decisions already by online ratings and brand reputation. And I do have this information sourced if anybody will send this presentation to anyone who's interested, but I have a lot of academic sources for a lot of this information as well. So Generation X, again, they want to feel connected. So at this point, you start to think about the messaging there. They're responsible for healthcare decisions that not only impact themselves, but their children and their parents. So we're very familiar with that, and so they're looking at, because of that, they're looking at a lot of decisions are influenced by convenience, selecting for multiple locations. So as we start to think operationally about when you're challenged of why are we doing walk-in hours, or why are we doing a Saturday clinic, or what have you, again, it's kind of helping to change the mindset internally that we're there for our patients, not necessarily for our own convenience. So millennials, again, that group from born 81 to 97, they want instant information. Having said that, they prefer passive forms of communication, so which could be emails, texts, those types of things, so they can process information on their own time. So you can kind of think about how all of these types of things start to affect the way that we communicate. And we have Generation Z, they're the influencers. They expect a personalized experience. And they actually actively avoid at least traditional ads. So, and again, so as we think about those different targeting types of things, there are lots of, and for the purpose of this presentation, we're not getting into a lot of the particular methods of communication. This is more of just more of a conceptual of how we target our messages. But I would say that, again, depending on those different demographics that we're focusing on, digital marketing in itself is playing more and more of a really prominent role in rural healthcare marketing. And I know that depending on what part of the country you're in, I'll hear, well, there's a limited broadband access and things like that. Although that is true, it is not as much of an issue as we sometimes hear when it comes to, there are specific results in terms of how digital marketing does impact behavior. And one of the ways that why it's effective is that it really allows us to target key decisions in a very cost-effective type of approach as well. So where it can be a lot more targeted in our message. And I'm just hitting the very basics of this, but that almost is another webinar. But for the purpose of this, it's just to say that there are lots of ways that we, one is deciding up front, okay, how are we going to reach, these various audiences? What or who are we going to reach? And then the how, there's a number of different techniques in terms of, traditional and digital advertising, as an example. And again, when it comes to digital, it's just amazing at how specific we can get and how granular that we can get. This is just one example of, where you can directly have an impact in terms of, appointments that are made in volume, increasing volumes and things like that. And, so won't get into too much more detail on that, but just to say that, again, that could be a whole new webinar, but just to kind of emphasize with you that if you're not going in this direction, certainly a way that we need to keep thinking. So as we do that, again, we talked about a lot of the ways that we're measuring results before. So when we look at those goals that we're talking about, certainly we want to be measuring goals based on, volumes and market share and all those good things. And of course, when we look at digital as well, and again, this is falling more into the communication goals, but we want to be looking at how we're driving those types of, how we're influencing decisions that way as well. And this is actually the result of what this particular organization achieved through their digital advertising. So these are the types of things that you can expect, that you should expect, from your marketing. So again, without getting into too much detail here, is just to say that, marketing has definitely evolved and that the types of procedures, the types of techniques we're talking about in marketing in terms of digital and traditional and other approaches is not something that is exclusive to larger metropolitan areas. In fact, I would say quite the opposite, that in terms of being cost efficient and having impact, that digital, it's one of the advantages that maybe we have right now to be a little bit more targeted in our message. So lots of approaches to take on that. Again, in terms of driving traffic, driving volumes, those types of things. So I just wanted to kind of show you those to you just as an illustrative type of point. So happy to take any questions, but again, I would just say that in conclusion that, in terms of targeting our message, we want to look at first and foremost is doing the work up front in terms of really understanding what our particular situation, what is our environment, what kind of capacity, opportunity do we have, then forming those measurable objectives and continually looking at how are we doing against those goals. The advertising part of it and the promotion part of it, certainly there's a lot of techniques out there, and it's a matter of being able to adjust, and we certainly can now do a lot more adjustment based on, there's still a large role in my mind for traditional advertising in terms of whether or not that's newspaper or print or direct mail. There's certainly a role for that, but one of the advantages of of more on the digital side of things is that we can adapt pretty easily to either alter messages or change different advertising strategies in order to reach our goals. So with that, Colleen, I'll end it there and certainly open up for any questions that people may have.
Thanks so much, Mike. I did just get a question. What do you find are typical marketing budgets for rural healthcare organization?
Well, I think that's going to depend a little bit on the environment and all of that. And, uh, that's going to, if someone has a particular question on that, I'd certainly invite them to reach out to me. That honestly, that's a really tough one to answer because there's so many variables. Uh, so I actually, if whoever has that question, if they want to reach out to me on that and maybe give me a little bit more specifics on that. I mean, there are a lot of ways that sometimes it gets measured based on a percentage of gross revenue or, there's just a lot of different formulas for that. So it's really hard to give you a typical, but if whoever asks that, they want to reach out to me, I'm happy to give them a little guidance on that.
Thanks. I'll make sure that you get connected
Okay. Sounds
before the end of the day. That was really the only question I had. So
good.
wonderful presentation. Thank you so much for taking the time to put it together. And thank you to all of our attendees for joining us today. As a reminder, you'll get a link to the recording before the end of the day. Mike, before I completely close down the webinar, is there anything else you'd like to impart on us?
Just again, thank you everyone for joining us. I hope you found it really helpful. And if you have any questions or you have any suggestions for future presentations, my contact information is up on the screen. And I believe the presentation also will be available for people to download as well, right, Colleen? Is that how, or do we send that out? I can't remember how we do that, but
Completely up to you. I can send it or you can send it.
yeah, we'll go ahead and send it. I guess we'll go ahead and send it and do a follow-up email to folks with a PDF of it. But anyway, if you have any questions in the meantime, don't hesitate to reach out. Hope you found it helpful.
Thanks so much. Enjoy the rest of your day. Stay safe and healthy. Bye-bye.